About a third of patients that have acute myeloid leukemia will have disease characterized by a FLT3 mutation. Presence of a FLT3 mutation can confer poor prognosis, and prior studies have shown that patients with FLT3 mutations have a shorter time period that they remain disease-free, they have higher recurrence rates, and just an overall worse clinical outcome. Now, to address this issue, there was earlier this year a drug which was approved for the treatment of patients with FLT3 mutant AML. This drug, midostaurin, is an oral kinase inhibitor of FLT3, which, when added to standard chemotherapy for younger patients with FLT3 mutant AML, was shown to improve outcome and overall survival in those patients over a significant period of time, and to decrease the relapse rate. Now, since midostaurin was developed several years ago, many companies have gone forward with newer generation kinase inhibitors to try to improve the potency and specificity of those agents and improve, obviously, clinical outcome. So the study that I'll be presenting involves a novel new generation oral FLT3 kinase inhibitor, which has been specifically designed to have more targeted, potent, and specific inhibition of FLT3 as compared to midostaurin. Midostaurin targets many other kinases. This is highly specific. It also has a very short half-life of 6 to 8 hours, so it doesn't have as many potential drug-to-drug interactions. And because it only targets FLT3 and one other kinase, c-KIT kinase, it might have less toxicity and be better tolerated than midostaurin.